Thyroid cancer. So I've been getting a lot of DMs on what thyroid cancer is, and let's talk about the two most important things that can raise the risk of thyroid cancer. Number one, if you have family members who have thyroid cancer, you are at a high risk and you can get yourself examined. And the next is radiation treatment for another cancer, for example, a head and neck cancer or breast cancer. It's not just like simple exposure to x-rays. Thyroid issues in general are more common in females compared to men, but it can happen in anyone. Thyroid nodules are tiny little lumps that appear in the thyroid. Sometimes you can feel it when you swallow, sometimes you can see it in the mirror, but most commonly they are really tiny and kind of inside. So an ultrasound of the thyroid is useful in that case. So if your doctor examines you and feels a lump in the neck, or if you feel something on your own when you have a strong background risk factor for thyroid cancer, you can get an ultrasound. And this is a picture of an image of thyroid. It kind of sits in front of our windpipe, and these are just some nodules that are there on the thyroid. So we measure them and see if they are at risk for developing thyroid cancer. Not all nodules are dangerous. Some of them are just there because of age-related degeneration. So they're common in older females, but if they are large, if they have certain characteristics on ultrasound, we biopsy them. That's a tiny little needle to biopsy and see if it is cancerous or not.